Today's podcast is our first, and I'm really pleased that we have such a strong advocate for mental health with us today to talk about mental health in Irish schools. Mark Ward is a Sinn Féin TD for Dublin Midwest and Sinn Féin Party spokesperson on mental health, as well as being a behavioural therapist and a long-time activist in his community. Hi Mark, thanks for taking part today.
Alison, thanks very much for having me on. Delighted to be here.
The approach to mental health in the school system in Ireland must be improved. Student and parent voices are missing from this vital discussion. Therefore, I am creating this video podcast series to interview students, parents, and past pupils, those who also wish to advocate alongside our voices in order to strive for change. Tell us a bit about yourself, your background, and why you wanted to get involved in the Mental Health in Irish Schools Transition Year Project 2020 to 2021.
Okay, I'll try and answer all that question. So about myself, I'm from an area in Dublin called North Condorcan. It's an area of social deprivation over the years. Like there was loads of houses put in without any of the infrastructure, and because of that, there was a lot of there was an impact on even family members of mine, neighbours of mine, and my community in general, where a lot of people would have been impacted either through addiction or through mental health issues, and a direct result of government policies at the time. So that's one of the reasons why I kind of got into this line of work, because I've seen the impact that decisions at the highest level have made on the community where I'm from. So that was the start of that for me. The reason I got in touch with yourself after I got the email in relation to the transitional years project that you're doing, any forum that is going to speak about and improve people's access to mental health care is really, really welcome, Alison. Like I can't say enough. The more that people talk about it, and the more that people engage with each other, the less of a stigma that there will be in relation to mental health.
Yeah.
It would also start influencing the decision makers like myself, who are in a position where we can advocate for change at the highest level. If you get people like us talking about that, therefore it's likely to have a knock-on effect to individual communities like your own and individual schools like your own as well.
Yeah. How do you feel the approach surrounding mental health has changed since you were in school? How do you feel we can further this conversation and make more changes in Irish schools?
Okay, so I'm from a generation, for example, when I was in school, no matter what was going on, you didn't talk about it. Even as I got older, just because of a generational thing more than anything else, I found it difficult to speak about anything that was going on for me at the time. So when we were in school, in fairness to teachers and who would have been in school, they done their best. In fairness, with the skill set that he had at the time, but they were coming from a different generation than I was as well. So they would have found anybody that was experiencing any mental health difficulties or any addiction issues or any behavioral issues extremely challenging to deal with. So so the difference between now and then, because I've children in all levels of school now. So I have a child in primary school, I have a child in secondary school, I have a child in third level, an adult child in third level education. And the difference now is that it's more open, the conversations. There's a lot of peer support that can be, but I'll talk about the other side of that in a second. But there'll be a lot of peer support if you have a good circle of friends around you and you can rely on that. The conversations around how you're feeling are a lot more open now, in my opinion, than it was when I was growing up, which is a good thing. The other side of that is where peer support comes in. There's also peer pressure that can come in that can have a detrimental effect on people. Peer pressure would have been something that I would have been impacted on, as we all would have been in school, having to do something a certain way or act a certain way or be a certain way because your peers are doing that. It can be put a lot of pressure on an individual, especially a young person. The impact that social media then has on peer pressure and how people feel about themselves and how people see themselves has added another dimension into what young people are experiencing, where it's really, really good for keeping connectivity with your friends. It's always also really good to go and find reputable sources of information where you can go and basically help yourself. It also has the counter side of that as well, as in all the information you get on social media is not true.
Yeah.
It can add to stress. There's a lot of false information out there. There's a lot of scaremongering out there, and then there's also the other side of it. And I've dealt with Coco's Law back, because that young lady that died out my way, Nicole, she's from my area originally. So cyberbullying was a big thing, and that's something that I wouldn't have experienced growing up because I wasn't around. And it's something that as decision makers, we need to make sure there's safeguards in place so young people like yourself and your classmates don't have to and shouldn't be impacted by other people's negative opinion of yourself and cyberbullying that went on in that case.
Yeah. In 2018, you shared your MS diagnosis with the journal.ie. How has it impacted your life? You spoke you spoke on a medical diagnosis does not define who you are. Tell me, how do you mind your own mental health and well-being, especially now in the time of a pandemic?
Okay, so I was diagnosed with multiple sclerosis approximately 14 years ago now. Now, in numerous years before that, I ended up in hospital. I was getting tests. But I wasn't getting any diagnosis. They couldn't figure out what was going on, even though I knew that something was going on. It was a really frightening place to be. I was always very active in sports, and I found my physical health had deteriorated over the years, so I couldn't get myself. I remember going back trying to play football with another friend of mine who stopped at the same stage as I did. I mean, two of us went back at the same time. He was able to get his fitness up a lot quicker than I was. And I couldn't understand that. And that was one of the impacts of multiple sclerosis, but I wasn't diagnosed at the time. It also led to me starting getting panic attacks and all that kind of stuff as well in relation to it. And I didn't know the reason for that. And I said, it's a really frightening place to be. I eventually got diagnosed in 2014. I remember the first thing that I said to the neurologist when he diagnosed me was thank you, because at least I could name what it was now. In my head I could name what it was, and I could go and fight that. Now that's the outward way I was portraying it, but inwardly, which I wasn't portraying, I was very frightened. I was very nervous. I was a father of two kids at the time, and I was worried about how I was going to provide for my family and all that kind of stuff going forward. One of the things I done, which I recommend no one ever does, and that's one of the reasons why I came out and spoke about it, was that I done Dr. Google. Dr. Google, as I mentioned, false information on the internet only led me down dark roads and just gave me the worst kind of possible outcome, manageable for multiple sclerosis. Where if you look at the stats now in a kind of my mind is in a different place, I know there's only a small percentage of people that have multiple sclerosis will end up with the kind of worst case scenario of it. But my head wouldn't allow me to think of that at the time. So I found myself getting withdrawn from my family, from my friends. I was suffering with depression, but I didn't know I was suffering with depression. Right. So this is what I was only afterwards when I found out it was. I came isolated within the family unit. I came isolated from friends. But when I was out in the community, I was kind of telling people how much I was fighting this multiple sclerosis and I was going to do this and I was going to do that. When inside I was really frightened. But because, as I mentioned before, I'm a man of a certain generation, and at that time I hadn't got the ability, the capacity to articulate how I was feeling. So I couldn't be able to say, what I'm saying to you, Alison, is that I was frightened. I was terrified. I was scared. I was worried about my future. I was worried about my family. I couldn't say that to anybody. I didn't know how to, because I was that much of what other people would think of me. They like, a man doesn't be scared, which is, I know, was totally wrong now. So that went on for a number of years. I would have lost jobs. I would have became very unwell in myself. I would have withdrawn more from society, until I eventually took a big risk in my head, which was a huge risk, and it was a simple thing. It was just I went and spoke to somebody, and I told them what I just told you, that I was frightened. And when I said that, and the whole world didn't open up and swallow me and spit me out, and nothing really negative happened, it allowed me then the space then to go and speak more about it, and then explore it in the right way, and how I was going to turn this around and make this, even though I have got multiple sclerosis, it was to say that it wasn't going to define who I was going forward. So at that stage, I think I would have I decided to look at a different career path. I was working in logistics at the time. I was still active in the community, but I was looking to go into something that I wanted to do, and that was going to be more beneficial for me and beneficial for the community that I represent. So I went into behavioral therapy and specializing with people with addiction, and I started in the college on that, and I also started working in the field on that as well at the same time. So that kind of led me into that work. So over the years I have got to the stage where I don't say I have multiple sclerosis. I say multiple sclerosis has me, and God love it. That's the way I kind of speak at it now this days, because I find myself difficult to live with half the time. So I can only imagine what that feels like with me, because I'm a torment. So I only went public in 2018. I was when I went public. I was a councillor at the time. I think I might have been the mayor of South Dublin at the time. When I went public, I was the mayor of South Dublin at the time. I went public for two reasons, but one of the main reason was because of how it impacted me as when I was first diagnosed and what I done, and I thought my story could help other people that are newly diagnosed. I also went public because I like to set myself high targets and all that. I decided that I was going to run the Dublin City Marathon that year. Now, before that, I hadn't run any more than I hadn't run 5K, never mind 142K. So, but once I went public and said that was one of the kind of things I said, right, I'm at the sign now, I'm going to have to do it. So I got myself a training regime, and I stuck to it, and I eventually completed the Dublin City Marathon in 2018. One of the best experiences of my life. I must say, when I crossed that finishing line, I was very emotional, because a number of years before that, a good few years before that, I was on a walking stick going around. I was very sick in myself. I didn't see any much hope, and there I was completing a marathon, something that I always thought other people did and not myself. So that's basically in relation to the multiple sclerosis. So as I said, I don't let it define me. It doesn't bother me on a daily basis, and this is just for me. It doesn't bother me on a daily basis most days. The odd days I'll feel an extra bit of fatigue, which is natural with it. So other days I might have a pain in some of my extremities, or I might have a sense of like pins and needles and things like that. But they're not that severe, and I'm lucky enough that I can manage my symptoms as they go on. So that's where I am with it at the moment. Does that answer your question?
Yeah.
Okay.
As part of the Mental Health in Irish Schools Transition Year project, I have started a petition to highlight the lack of mental health supports in schools and to ask the Irish government to provide a dedicated mental health support service for Irish schools. The petition draws on the Irish Association of Counselling and Psychotherapy commissioned National Crisis Survey in March 2019, in which 9 in 10 adults strongly wish for therapeutic counselling services to be made in all schools in Ireland. Why did you sign the petition, and what is the message you'd like to share with the people watching this interview?
Okay, to answer your question, I signed the petition because I think it's a really good idea. I think it's something that we should be doing as a nation. Like, I know schools nowadays, and they hadn't got on my day, they have career guidance teachers and guidance teachers within the school. But sometimes if you have somebody external that's not part of the school to speak to, that comes into the school, it's a lot easier for students to speak to. Because sometimes the students are still, they might have to go, and because I know myself, we had career guidance rather than just guidance teachers in school, and if you did feel like you were going to talk about something personal and something that was bothering you, and it's fine and you can talk on that, but then that same teacher could be teaching you geography an hour later. So when you're going back into that environment, and it's not the same as having the external supports that might be coming into the school. So I think that's something that really should be available to all students, not even just at secondary level. I think even at primary level there should be some sort of avenue where pupils can access the services they need. I think it would really be beneficial for students, especially at the moment, because we're going through one of the unbelievable times in our history. Hopefully we'll never go through something like this again in relation to COVID and the pandemic, and any issue that might have been there in the first place in relation to mental health. COVID has brought a lot of the issues right to the forefront, but it's also brought the lack of services and the difficulties that people have of all ages, not just students, of accessing services that they're going to need to benefit their mental health. So yeah, so that's the reason why I signed the petition. I thought it was a really good idea. I thought it was really innovative. So congratulations on bringing that forward. And if there's anything that you think I can do going forward that's going to bring that forward, I would have no hesitancy in offering my help on that as well.
Thank you. Thank you for showing your support towards my mental health and Irish Schools Transition Year project. Your time, words, and commitment to the mental health of young people in Ireland is valued and appreciated.
Okay, thank you.